Good afternoon, and welcome to today's special webinar celebrating the success of our Health Visions Delmarva Practice Transformation Network. My name is Valencia Harper, and I will be your facilitator today. At this time, all attendee lines are muted for this session to minimize background noise and distractions. We encourage your questions and input throughout this presentation. Please feel free to use the raise hand icon in your taskbar or submit questions and comments in the chat box provided. Today's presentation will also be recorded and later uploaded to our Health Visions Delmarva PTN YouTube channel. You may find the link on the flyer included in the invite to today's webinar. Today's event is a little different. We will be hearing from your peers, PTN members who represent just a fraction of the success stories we are seeing in our transformation work. We hope that you enjoy hearing from your fellow practices and that you are able to take away ideas to incorporate into your own practice. To kick off today's event, I would like to hand it over to Cindy Eisman, Project Manager for Health Visions Delmarva PTN. Cindy, let's begin.
Thanks, Valencia. And I want to echo that welcome. Thanks all of you for joining us today, and just thanks all of you for being a part of this Practice Transformation Network. I did want to make one note, and that is if you are one of our presenters today, we're going to be unmuting your line. So if you have worked with us and you practiced and you know you're going to speak, please make sure that your phone is on mute on your end so that when we open your microphone, we don't have any interference. So let's start with our learning objective and questions to run on. It may be a celebration, but we're still trying to learn something today. So our learning objective is to recognize our members for their achievements at this midpoint of the 4-year TCPI project, and to share their success with peers to encourage additional improvements in years 3 and 4. So what are our questions to run on? What have we achieved in 2 years of transformation? It's a lot, and as Valencia said, this is just a small portion of the things that have been accomplished in the last 2 years. How can I learn from my peers and implement their ideas to improve my own practice? What can I share with my peers about my transformation journey that will help them to continue to improve? And with QPP MIPS now in full swing, what are the future goals of practice transformation? So our agenda is pretty simple. We're going to have a spotlight section where we're going to spotlight 4 practices who have different stories about transformation work that they've been doing. Then we're going to spend a significant amount of time on recognition and thanks. We want to recognize all of our practices for the great work they've been doing in specific and in general ways. And then finally, we're going to talk briefly about year 3 of TCPI and what's in store for our practices as we move into the second half of our grant. So our first spotlight is going to be done by Tabby Oviedo from the Vein Center in Eden Hill. And right now, I'd like to introduce Gail Tanchenko, one of our practice advisors, to kick this one off. Go ahead, Gail.
Thank you very much, Cindy. Good afternoon, everyone, and thank you very much for being a part of our midpoint celebration. This is Gail Tanchenko. I am the Practice Value and Improvement Analyst for Bay Health Physician Alliance and also one of the practice advisors for Health Visions Delmarva. I am very excited to have Tabby Oviedo, Office Manager of the Vein Center at Eden Hill, share their success story. Tabby is also our super user for the EHR affinity group, assisting practices with the same EHR to move their chosen quality scores to target. Without further ado, I hand over to Tabby for their presentation on improving our quality measures. Tabby?
Hi, this is Tabby. I'm going to talk about improving our quality measures. What is the one thing your practice advisors ask you to provide at the end of each quarter? I need a copy of your quarterly report, please. Please email me a copy of your quality measures. And deadline to provide your quarterly report is on. I'm pretty sure that's how we all look like. Our baseline quality measures on documentation of current medication and BMI follow-up were at a decile 3 and 4. We needed to do something, and we were determined to improve. We didn't want to get overwhelmed and miss important things, so we revamped our chart prep. We've been doing chart preps for years now, but we recently revised our workflow to meet our chosen quality measures and identify care gaps by utilizing direct messaging, Delaware Health Information Network, and reaching out to PCPs and other specialists for office notes and pertinent testing. Our practice advisor always reminds us to be best friends with our EHR and get those tip sheets. From the tip sheets, we were able to understand each of our chosen measures. We learned which patients would fall into numerator and denominator, and if there are patients that are supposed to be excluded or exempted. Of course, we should not forget to click the box so documentation can be captured. We worked as a team. We all took training. We took the time to check and audit our charts with our center of providing the best care to those we serve. So here is the fruit of our labor. Documentation of current medications, a top measure, and since we are submitting through registry, it is tough. If we didn't miss 2 charts, we could have been on a decile 10. For BMI and screening and follow-up plan, we actually surpassed our goal. And of course, we never forget to recognize the whole team with all their hard work. Our practice advisor developed an affinity group connecting practices with a similar EHR system. We are sharing step-by-step processes to meet common quality measures, provide comments and feedback from the Health Visions Delmarva PTN and Bay Health Physician Alliance. Thank you from our team at the Vein Center at Eden Hill. Thank you for listening.
Thank you so much for providing that overview, Tabby. I think that the fact just that you guys worked so well as a team and really spent a lot of time figuring out how to really understand how your EHR was capturing that data was so important, and you really did have great success. I also really liked that you pointed out that you have to give people credit and recognize them for their contributions, because I think that's such an important part of performance improvement and teamwork. So thanks again, Tabby. Our next story is going to be presented by Peninsula Orthopedics, and I give you Tina Basil, Practice Advisor with Health Visions Delmarva. Go ahead, Tina.
This is Tina Basil. I work in Maryland with a variety of practices that are between Salisbury, Maryland, Annapolis, Towson, and the Laurel area. I am pleased to present today Megan Davis from Peninsula Orthopedic Associates. They have used a very creative method to do improvement on their quality measures, and Megan is here today to tell you about it. Thank you, Megan, for joining us. You can unmute your line now, Megan.
Yes, I'm here. Hi, everybody. Thank you, Tina. Thank you, Cindy, for I guess having me. So I guess we'll get right into it as to how we have kind of created our challenges and goals here. So you know, when we started this, the whole MIPS program, the project, if you will, we had quite a few challenges that surrounded our EHR. I'm sure, as a lot of you know, making sure, and I think somebody said before, making sure that you're friends with your EHR is crucial, but so is what the EHR is capable of. So in order to improve our quality measures, we had to fully understand what was kind of inhibiting our quality measures. Of course, team member engagement throughout the entire practice. We looked at an approach that I'll discuss in a few moments that actually included every single person that works here at Peninsula Orthopedics, from administration all the way through the clinical side, coding, billing, you name it. We made sure that we tried to engage them. And then also how we engage the patients. Things that are in our improvement activities and things of that nature, like patient interaction through surveys and stuff like that. So we examined a lot of those and found them to be our greatest challenges in moving forward. Okay, so yeah, thank you. So as we were planning for MIPS, again, we looked at our lack of quality orthopedic measures within our EHR, and being able to, or not being able to, I should say, submit our data to CMS because we had a large gap in our reporting function and in again the measures that were actually available to us through our EHR. In terms of staff, you know, PQRS may have been out for quite some time, we all know that, but you know, moving into the entire MIPS program, there was a lack of teamwork, not because people were uninterested or disinterested or didn't want to be doing it. They didn't have the training or the education that was really needed. Patient engagement also limited. I know in our practice, the people who are coming in and out, you know, as with many doctors' offices, they're in pain or they're not feeling well. So being able to engage with them and making it an important part of their visit is challenging. So since then, we have selected our clinical registry. We're actually going with Able Health. Their dashboard, their capability was very impressive to me. We actually vetted close to 40 registry services and had demos with over a dozen, and all based on the CMS website's list of qualified clinical registries. So that was a big undertaking. We spent many weeks on doing that to make sure that we chose somebody that had the capability of working with us and our limited EHR, which was very important to us. We selected our quality measures, important to the practice. Some of them are new. Some of them are things that we've been doing all the time. I wanted to make sure that people understood that their day-to-day wouldn't have a dramatic change. And I think that as we incrementally approach MIPS and grow with the program, it's important to make sure that people within your practice know that this isn't insurmountable. That it's totally attainable and we can be very successful at it. So that's when we went into identifying the roles and responsibilities of each metric, who actually currently does it. We sat down with our supervisors from our clinical staff. We had the people who lead our CAs, our MAs, our physicians and our PAs, and we actually went measure by measure, identifying, okay, in your normal day-to-day, who does your data input? You know, who actually speaks to the patient? Who does everything? So that we knew on the administrative end that we weren't asking something of someone who didn't understand or it wasn't their job function. And that's when we went in to develop our implementation plan. That was exciting for me because I actually then got to see everything come together. And from a data perspective, it was fun to watch people become engaged, because then they realized, oh, this isn't bad. This isn't going to be something that's going to take up a large portion of time that I don't have. I can still make the patients the center of my focus and be successful in MIPS. So moving into developing our dashboard, we made sure to highlight those performance indicators. We made sure that from the very beginning of selecting our quality measures right down to going through our registry services and creating our dashboard, that we actually can provide our team here, the PAs, the MAs, the CAs, everyone who's actually participating, that we provide them real-time data via the dashboard and the performance metrics so that they see, like, oh, everything I'm doing every day is actually making a big impact. I'm part of this. I'm invested. And that was really important to us. So here we have kind of like where we stand currently with our implementation plan. It just kind of gives you an idea of our tasks and who's responsible and where we currently stand. So what was important when we sat with our management is coming up with those responsible parties. We actually did the RACI diagram, and we put together that diagram to help us as we were coming up with this implementation plan. So you'll see where we are now on task 8. We are compiling data every other week, and we provide that data through our registry service and their dashboard, and which is, of course, getting the data from our EHR. Due to the limited capability of our EHR, because again, they're growing with this as well. And I know sometimes it's frustrating because we think that we know, hey, this should be super easy because these are things that we've been doing forever, but we've been talking about it in different language. So it's us helping that language catch up. So every 15 days we compile new data and we provide that to our team here, and so that they can see where they stand, and it gives them time to course correct. You know, if you have a metric that you see you're only performing, you know, bottom 25%, hey, now I know over the next 2 weeks I need to focus on that. I need to make sure I'm checking this box. We actually have started compiling kind of templated draft frameworks of manuals for our teams. So the PAs will get a manual that talks to them. It uses their language. It doesn't have a bunch of unnecessary data that doesn't pertain to them. And then the MAs, who do a very different role, they get a different training manual. And then we actually will create that to grow with us. So as our metrics change, they'll get an updated version of that manual so that everyone's getting the data that pertains to them, so that they don't feel flooded with information that they feel like they don't have to know, but yet they have a very high level understanding in our meetings of how their part fits in to the other parts, because that's the most important thing as we talk about teamwork. Understanding that where you are in the process affects the people both before you and after you. So the teams, what we're trying to do here is create a little bit of a competition. So we put together kind of a tournament-style sports metaphor kind of thing here, because that's really popular here at POA. So we actually provide them with the data results every 15 days. We provide them with stat cards, just like they were baseball players or football players. And on their stats card is their team standing and a list of where everybody else stands. We did make a small adjustment in that the teams don't know where the other teams stand, because what we found is we didn't want anyone to see themselves at the bottom and everybody else know that they were at the bottom. They know where they stand and they know what measures they need to work on. But this way, everyone constantly is motivated to keep doing better, to keep making sure their metrics and their quality measures are improving. And we share the measure data so that others can learn, like, oh, well, last week, I saw that my player stats cards put me in 7th position out of 10. So I know that I need to work on these metrics, and I know that in 15 days, I'm going to get a new stats card, and I want to be maybe number 5 because I want to keep moving up. So we review the results, and we make recommendations for improvement. We do one-on-one with those teams, and we say, hey, guys, what are you having trouble with? Is it that you don't know that you're supposed to be doing it, or do you think somebody else is doing it, or do you not understand that I need to check this box? And we like the one-on-ones, and we like the small group kind of roundtables so that everyone feels that they're learning and that they have a chance for improvement without feeling like they're being unsuccessful. Because no matter what, we're successful as a team, or we fail as a team. We are practice whole, you know, the 3 musketeers, all for one for all kind of mentality. But we also want them to feel like they have a sense of authority and empowerment to channel their own destiny, if you will. We provide those graphs, like I said, with the dashboards, and we do recognize our winners. So at the end of the tournament, the team that wins will get a prize from our upper management team. So we think it's important. I know the last person who spoke, you know, recognizing your winners, and we are absolutely going to keep doing that. And then we're going to take what we learn from this activity, and we're going to put it towards next year and making it better and making it even more inclusive and even more successful.
Thank you so much, Megan, for sharing that with us. I love the idea of making it a competition and injecting some fun and creativity into it. It's, you know, this is a thing that we all need to do, but that doesn't mean that we can't make it be something that people are really engaged in. So thank you so much for sharing your story with us today.
Thank you.
You're welcome. So our next spotlight is going to be on Colon and Rectal Surgery Associates, and I give you Barb Vugrinic, Senior Practice Advisor, to introduce this one.
Thank you, Cindy. I am proud to introduce Jennifer Monet, Practice Administrator from Colon and Rectal Surgery of Delaware. When I first met Jennifer and asked her about cost savings and unnecessary testing, she stated, yeah, we're doing that already with one of our physicians. So we really learned from, actually, Jennifer on stuff that she has been doing. So I will now like to present and turn it over to Jennifer so she can present her project. Jennifer?
Thanks, Barbara. Okay. We had a challenge that was presented to us, and we thought that we were, excuse me, ordering colonoscopies too frequently. Now, in order to do that, we also wanted to make sure that we could save on the cost of colonoscopies. But first, to start that out, we want to give everybody an idea as to how the process works and how frequently the colonoscopies are ordered. On the screen, you'll see where it has the testing times. As far as an average screening, it begins at age 50, and a retest is done in 10 years if there's a normal colonoscopy, which means there's no adenomas, no risk factors, no evidence of cancer. The retest is done in 5 to 10 years if there are polyps removed, usually if they're small, low-risk adenomas. And then there's another factor that's involved is the testing time is determined by the physician depending upon the size of the adenoma, depending on the patient's personal history for inflammatory bowel disease, and relatives with a history of colon cancer and or polyps. Next slide. So we decided to put the plan together with Barbara and myself, and we had the rest of the staff involved. So we put the team together, and we had a baseline report produced to kind of determine where our current status was, and then a process flow was designed. Once that was designed, we decided to put our plan in action. So we decided that we needed a physician coordinator to kind of streamline things. Dr. Shakamori was the pilot physician who wanted a personal coordinator, so we decided to make him happy by doing so. By doing that, she is able to hone in on all of his patients, able to get a complete history on that patient. She contacts each patient individually, asks them when their last colonoscopy was performed, what kind of symptoms they're having, and she obtains all of the testing and results. So once she was done doing that, we were able to see the patient here in the office. The doctor can do an assessment and move forward. So as a result, we were then producing quarterly reports and presenting them, to Barbara, and we went over those together to try to figure out how we were able to save on the colonoscopies. And we had very good results. We presented that to the physicians, and the results of the study is that the baseline average is that we were doing 47 colonoscopies per quarter. And the average colonoscopy cost is $950, which is something that's including the technical cost, which is like the facility fee, plus the professional cost, which is the cost for our physician. And the predicted savings for the actual colonoscopies per quarter, obviously the math is you do 47 colonoscopies per quarter times $950. So here's a graph indicating the spending and the amount, of colonoscopies we were performing. Now you'll see that there is going to be a variation in the summertime, that we tend to do more colonoscopies because we have the patients that come in from Florida. They tend to come
back in the summertime to get all of their testing done, and then we also have teachers who tend to come in the summertime as well when they aren't in the school schedule. So as a result, the average of the 3 quarters was $33,883, which totaled to a reduction of $10,767 quarterly. So we had a great deal of savings by implementing the coordinator to Dr. Shakamori. So as a result of the good response that we got from the coordinator, I decided that Barbara had reviewed the results with myself, and we had investigated, like I said, the reason for that small increase in the 3rd quarter, which is the summertime variation. And once that was done, I reviewed the results with the physicians, and I had made a recommendation to implement the coordinator functions with other physicians in the practice. I was able to do that, and now we are starting to pilot that with our other physician who seems to be engaged, and I believe that the other physicians will fall into place by doing that. And once we performed that, then Barbara had decided to create an affinity group with other Health Visions, Delmarva gastroenterology practices. That way we can communicate together and share our successes and go over any kind of problems that we may have to kind of improve our practices together. And the goal is to spread these utilization savings among other GI practices.
Thank you so much, Jennifer, for sharing your story with us today. I think this is a really good example of how clinically doing the recommended thing can actually be the most efficient way to do it also from a cost efficiency perspective. And we really do appreciate your work with the affinity group to help to spread this to the other gastro practices in the group. I think that it's a great model, and hopefully we'll be able to help other practices to implement the same model. So thanks again for sharing that with us today. Okay, our last spotlight is going to be Eastern Shore Rural Health, and this is a practice that I work with. Eastern Shore Rural Health is a federally qualified health center located at the bottom of the Delmarva Peninsula. There are one of our very few Virginia practices. And Jennifer Tyler, who is the Director of Clinical Operations at Eastern Shore Rural Health, is going to tell us about what they did. Now, I just wanted to quickly go over their challenge. They need to improve their performance in conducting depression screenings. And as an FQHC, they're reporting on and being evaluated on a standard set of quality measures that include that depression screening. And it's out there on the internet. Every year, this data is published on the HRSA site, and the whole world can see how they're doing on their measures. For 2016, they had only achieved 47.7% of the screenings completed, and so that put them in the 3rd quartile on those rankings. And that's not a place where they live on most of their rankings. They're in the 1st and 2nd quartile on a whole lot of them. So they wanted to do better. So their bold aim was to improve performance on depression screening and care planning to that 1st quartile for 2017. So Jennifer, I'm going to turn it over to you to explain what you guys did to impact that.
Good afternoon. Where we started from, I guess, first, we initially had a conversation, or broached a conversation in QA, because I lead the performance improvement, or co-chair the performance improvement committee with the chief operations officer, and we address organizational issues. And our performance, as you mentioned, Cindy, it was not where we wanted it to be on the depression measure. And to kind of dip our toe in, prior to me joining the group here at Eastern Shore Rural Health, the CMO had asked that each provider do 2 PHQs because it seemed like a daunting and overwhelming task for our providers to incorporate that into their daily workflow. So we kind of did a PDSA. We sat around the table and discussed ways that we would implement this, and we determined that a standardized nursing intake would not only impact the depression screenings, but also other quality measures. So we developed a new paper format for a nursing intake, which is given to patients as they check in up front, and they can begin filling that out. And at what point they are called back to the room, the patient is then asked the questions, or the assessment or the intake is completed by the nurse, gathering information from the patient in the room. And also, as I'm looking at these bullet points, we have a pre-visit daily huddle report as well that also identifies non-compliant patients. And when I say non-compliant patients, I mean patients that don't meet the requirement currently for whatever particular performance measure. So depression is one of the performance measures that's on this huddle. And our Chief Information Officer, Mike Zoden, created a report that queries the eClinical Work system and extracts the data from each of the patients that are on the schedule for each provider each day. And what that does is it populates that data onto this Excel spreadsheet, and if a patient is non-compliant, it highlights the patient in red, which draws the attention to the MA, or clinical assistant, or nurse that is working with that provider. That nurse then enters the non-compliant measure in the chief complaints section of the progress note, so we can let the provider know. But in the case of the depression screening, the nurse actually performs the depression screening. So we start out with the PHQ, and if the patient answers no to both of those questions, then that's recorded on a smart form within the electronic medical record system. However, if the patient answers yes to either of those questions, then it automatically goes into a smart form for PHQ 9, which then the nurse asks the patient the 9 questions on that form. If the patient scores a 15 or above on the PHQ 9, then the provider will work with the patient then to develop whatever plan of care interventions that they both agree upon. So be it referral to a mental health professional, initiating medication. We'll talk about it the next visit. I'm going to make you a follow-up in a couple of weeks to see how you're doing then. So those are the steps that we take. And as you can see here, we may have ended up at 48% at the end of the year for 2016, but prior to implementation of the standardized workflow, we started out at 9%. And you can see how we have trended upwards each year. And so this year we're very happy. And what you're seeing is year-to-date numbers. So I also do a rolling year depression because it's an annual screening. And so our year-to-date depression screening is at 64%. So we're going to be above the 60s by the end of the year. So
that's fantastic, Jennifer. So the other things that Jennifer and I had talked about were, what's next? So she already alluded to the fact that nursing intake is a really important way to kind of capture multiple screenings, to look at multiple measures and make sure that the things that they're trying to focus on are being fully implemented with the population. And then the second bullet was about the social determinants of health. So Jennifer, if you could just give us a couple sentences about what you're doing with that, because I know you're further redesigning that intake to address that.
Right. So we've looked at different options. We've looked at our electronic medical record system has what's called a prepare form. It is an assessment of social determinants. It's composed of 13 questions, which is lengthy when you're trying to add something to a workflow, and can be burdensome. Though it does assess all of the areas such as need for clothing, food, abuse in the home, and all of these other social determinants that would impact the patient's ability to care for themselves. So we have, as a matter of fact, just yesterday, or Tuesday, whatever day is today. But anyway, on Tuesday, we had a performance improvement meeting, and we determined that we want to come up with one question that would trigger multiple future questions. So rather than going through the prepare and the 13-question form, we're going to develop a smaller, less in-depth question that would trigger an additional questioning to identify specific needs. And we're working in that direction to see who would take care of answering those expanded questions. So we're thinking that, kind of tossing around, do we make a referral to outreach? Because we have an outreach department here, and we have outreach workers at each one of our centers. And those outreach workers are so familiar with the community resources, linkages to care, and that's part of their daily workflow. That's their job. So we're kind of kicking the can around as to asking the question. If the patient answers yes to that initial social determinants question, then we make the referral to outreach, and then outreach can further delve in, and that way it's not as burdensome to the patient intake or patient, the providers that are performing the patient intake.
Well, Jennifer, thank you so much for sharing the story with us today. I just really think that the stuff that Eastern Shore Rural Health does is just exemplary. And one of the things that it points to is the importance of having that time for that QA meeting or the Performance Improvement Program meeting, a meeting that's just separate to really talk about and be able to delve into issues. I know a lot of us say, well, we talk every day. We come to the office and we all talk to each other every day. But having that time set aside and carved out to actually focus in detail on these issues can really help you to find the solution that's going to be lasting for any problems that you're facing. So again, thank you, Jennifer.
You're welcome.
All right. Thanks to all of our practices who we spotlighted today. We are going to move on now to our awards section. And we do want to recognize all of you, first of all, in recognition of the dedicated and ongoing work all of our PTN community practices are doing. Thank you, thank you, thank you. I know that it serves the patient population well, and I think that going forward, we're going to have a lot more opportunity to share those things with each other. The first award that we want to talk about is the Teamwork Award. And the Teamwork Award is for outstanding teamwork by a multidisciplinary team, and we have 6 practices who we'd like to recognize there. The first is Advanced Foot and Ankle. This practice is truly a team. At each visit, both the physicians and the office manager participate with our HVD team meeting. Every initiative has been worked on by every member of the team at this practice. Alfieri Cardiology has a great team in place led by Pam Downs and Colleen Buchanan. They meet regularly with their practice advisor, quickly learned QI methods, and took the initiative in beginning several projects which will greatly improve their costs, their patient-employee satisfaction and engagement, and reduction of unnecessary tests. They're regularly checking their quality data. It's a standard part of what they do, and they make changes as needed. Delmarva Heart. The Delmarva Heart team represents 2 locations and routinely meets to address practice transformation issues. From patient engagement and communication to better use of the EHR, team huddles, and now the referral process, they continue to forge ahead with transformational change. While the composition of their team actually changes over time and with different projects, they remain focused on the results. ENT and Allergy of Delaware. The team at ENT and Allergy of Delaware is energetic and optimistic, and they have the best interests of the practice, its patients, and employees in mind at all times. The practice looks at quality frequently within the practice to see where they can improve, and they are often looking ahead to see what's next for them as a team and as a provider in the community. Holy Cross Radiation Oncology. This team has faithfully met every other week using remote go-to-meeting formats to redesign their intraday communication in support of their current daily huddles. Not being able to have on-site meetings has not held them back, and they continue to make progress. And while we've refocused a few times and it's evolved and changed, they're really dedicated, and we appreciate them participating. Peninsula Cardiology. Peninsula Cardiology meets weekly with their practice advisor, and this multidisciplinary team of Dr. Desmaris, Robin, Danielle, Dana, Sherry, and Blair have tackled pre-visit prep, patient engagement and communication, the MIPS measures, and now again the referral process. I call them my standard Friday lunch date. So thanks and congratulations to all of our teamwork winners. You really do exemplify teamwork in developing the TCPI program. Our next award is for Physician Champion, and this is for outstanding contribution by a physician to the TCPI process. We have 6 physicians here that we would like to recognize. And the first 2 actually are grouped together. Dr. Craig Hochstein and Dr. Thomas Vaughn, both at Bay Health, are really showing outstanding leadership in helping us work through our emergency department radiology test reduction initiative. They're working together on this. They've done chart reviews, and they are really dedicated to helping us see real change there in utilization of those tests. Dr. Un Chin brings a positive outlook to the table at every meeting. He's dedicated to providing superior patient outcomes by identifying quality improvement in his practice, and he attends all of our meetings with our practice advisor. We have Dr. Frances Seymour. Dr. Seymour consistently supports ideas that will improve her office processes and improve care for her patients, and again, routinely participates in those meetings. Dr. Ritu Chitaki. Dr. Chitaki is a solo practitioner and is committed to implementing MIPS concepts within her practice and uses processes to achieve the best outcomes for her patients. While she has a very small practice, Dr. Chitaki does some really innovative things to make sure she's providing the best care to her patients. And then finally, Dr. Ruth Horowitz. Dr. Horowitz is a champion within her practice. She's dedicated to implementing quality improvement methods within the practice, and she is an active part of the brainstorming of ideas at every meeting that they have. So we thank our physician champions for their help and support. Next, we have the Practice Management Champion. This is for outstanding contribution by a practice manager or support person to the TCPI process. First, we have Tracy Leedy. Tracy is with Gastroenterology Associates. Tracy's gone above and beyond to make improvements for her practice and participates through her team, but also a work group, an affinity group, and then individually with Health Visions Delmarva. She actively tracks the practice's quality data, is constantly looking at how to achieve higher scores, and her work ethic directly correlates and can be seen with the success of the practice. We have Trish Johnson from Surgical Associates. With Trish's efforts, the practice is on top of all deadlines, produces reports in an effective manner, is an extremely dependable team member, and she goes above and beyond for the benefit of the practice and team. At CNMRI, we have Audrey Lennox. Audrey's done a great job leading CNMRI with their no-show and fall screening projects. This practice has shown remarkable improvement with their TCP activities and milestones. And finally, we have Annette Schuler from Premier Orthopedic Bone and Joint Care. Annette constantly shows leadership when working on projects such as implementing a patient satisfaction survey and improving her MIPS scores. She diligently reviews her MIPS scores monthly, analyzes the data, and works with her team individually to improve the processes, which shows in their scores. So we thank our practice manager and support champions for their assistance also. Okay, the next award is the Collaboration Award. And this is for outstanding collaboration with another practice or organization. There are 4 practices here that are being recognized for this award, and they're all working on the same project but at different sites. Delmarva Emergency Physicians and Kent Diagnostic Imaging are part of the Bay Health System, and Emergency Services Associates in Delmarva Radiology are part of the PRMC system. These practices are working together to reduce the utilization of unnecessary testing in their EDs. Their collaboration includes the support of the PTN, but also the American College of Emergency Physicians and the American College of Radiology through their eQual and RScan programs. We're really excited to see the results in the 4th quarter and to share this success with the rest of our practices. We really thank these practices for their dedication to working together. It takes a lot of time to coordinate these collaborations, and we absolutely appreciate the time they're putting into it. The Quality Award. The Quality Award is for significant progress in chosen quality measures. Sussex Pulmonary and Endocrine Consultants have been working with Quality Insights of Delaware and Health Visions Delmarva and showing significant improvements in their hemoglobin A1C and blood pressure control measures. This practice has used several patient engagement tools which assisted them in improving their quality measures. And that idea of patient engagement is something we're going to revisit a lot in year 3. So we'll be hearing more from Sussex Pulmonary and Endocrine. the Vein Center at Eden Hill. As you saw in our first practice spotlight of the day, this practice has shown huge improvement with their chosen quality measures every quarter by consistently collecting, tracking, and analyzing their data, and then finding ways to enhance their scores. Delaware Clinical and Laboratory Physicians has been diligently working on their quality measures with their clinical team and has shown significant improvement. When their initial MIPS score was calculated, it was in the low 80s, but now their score is in the 90s, and this high achiever practice is working to have a score of 100 for their first MIPS reporting period. Delaware Clinical and Laboratory Physicians, did them again, Infusion Solutions of Delaware, and led specifically by Tracy Phillips. Tracy has worked above and beyond in moving Infusion Solutions of Delaware with her TCP activities and finding methods to improve their quality measures. She has proven to be a real needle mover and remains focused on continued improvement. They're working on even improving more, and they may not be happy absolutely with where they are right now, but they are moving quickly ahead and have made significant improvements. So Tracy, thank you for that. The Patient and Family Engagement Award. So this is for leadership in the use of patient and family engagement for operational and clinical improvement. First, we have Nancy Koch, gastroenterology. This practice created a new process in their office called direct access. They utilized patient engagement and developed a medical clearing guideline so that patients could be scheduled for a colonoscopy without first having to have an office visit. Not only was this a patient satisfier, but it turned out to be a cost-saving initiative. So they took something that their patients asked for. Please don't make us do an appointment before the colonoscopy. And they made that into something that not only was a patient satisfier, but was appropriate clinically and saved money. So that was an excellent use of patient and family engagement. All About Women has developed several patient engagement tools on their website, such as a food journal and a listing of weight loss website links. The practice is also participating in a program with the University of Delaware, who's providing nutritional counseling for their patients. In their patient engagement strategy, they've really worked on the area of patient activation and shared decision making, and they're using their e-tools to do that, which is a significant change within their practice. So again, we recognize these practices for patient and family engagement, something that we're all going to be talking a lot more about as we go into year 3. The Data Management, or EHR Award, is for exemplary use of the electronic health record and data aggregation and analysis to improve quality scores. Here we have three winners. We have Andrew Shronofsky from Internal Medicine of Dover. Andrew has selflessly dedicated himself to learn their EHR system, is part of an affinity group, and coaches clinicians and other staff in improving their chosen quality measures. We have Tabby Oviedo, who presented today. Tabby was determined to meet the quality measure goals, and once they met most of the targets, they were willing to share what they've learned with the affinity group with the aim of assisting practices to also meet their quality measures. Tabby was really instrumental in helping us to understand in the different EHRs how we could get to tip sheets and recommendations and workflows on how to document measures. And then finally, we have Raul Mangabit from Mercy Care for Women's Health. Raul's an expert when using the eClinicalWorks EHR. The practice has always provided their quarterly data. He's been available to talk to other eClinicalWorks practices when they have a question about the functionality of the product. And I think, Raul, I need to hook you up with Jennifer Tyler down at Eastern Shore Rural Health, because I know we're always looking for recommendations on how to maximize the use of that EHR. So thank you all for your data management support. The Cost Saving Initiative Award goes to Colon and Rectal Surgery Associates. As we saw today, Colon and Rectal Surgery of Delaware used evidence-based guidelines as a criteria for patients to receive colonoscopies. And after piloting and measuring their success, their performance data was shared with other physicians, and they'll now be implementing it throughout the practice. They had significant savings from that initiative, and we hope to be able to spread that throughout the PTN with our other gastro practices. So thank you, Jennifer. The Patient Care Huddle Champion goes to Urology Associates of Dover. This practice conducts their huddle every day. It aids them in preparing for their workday and provide assistance to any team member, identify care gaps, find ways to engage with their patients who have missed follow-ups, and it's been working effectively. It brings the whole group together to provide effective communication to each other and their patients. They're doing a great job with Patient Huddle. The Creativity Award goes to Peninsula Orthopedics. As you saw from Megan's presentation today, Peninsula has set their goal of improving quality measures, and Megan, as their data analyst, has implemented a creative sports team competition, including staff throughout the practice, to actually be able to hit those goals. That was a really creative approach to problem solving, and it hits on that milestone of bringing joy to the workplace, because when you're involving your staff, that's how you really effectively bring joy into the workplace. Our Rookie of the Year. Delaware Dermatology gets the Rookie of the Year award. This is the first year that Delaware Dermatology will be submitting quality measures to CMS, and they are meeting the highest decile for their documentation of current med quality measure for all quarters in 2017. They've also done outstanding work on their no-show project, reducing their no-show rate and improving patient compliance and continuity of care. For a practice who had never submitted quality data, they have remarkable results. They've really devoted themselves to it and understanding how to document, but also how to provide the care to meet those quality measures, and they're doing a great job. So congratulations, Delaware Dermatology, for your Rookie Year success. The next three practices are receiving our Transformation Vanguard Award. And the Transformation Vanguard exhibit leadership in self-initiating change using TCPI principles independently. The first one is Rheumatology Associates of Baltimore. Ann Marslett is the practice manager there, and she's implemented innovative ways to study and improve patient engagement and outcomes by identifying cost-free resources through pharmaceutical companies. So she wanted to do more to get that patient input, to have that patient engagement, and she identified a source outside the practice that would help her basically to do that. And that's great initiative being taken on their part. Eastern Shore Rural Health. So that's another practice that shared their success story today. They're a high-functioning practice and with significant experience in performance improvement. And over the past year, they identified that depression screening measure separate from my meetings with them. It was just in their routine, normal process of always analyzing their data, always analyzing their performance. I'm really impressed with what they have been able to achieve in just 6 months on that measure by sitting down, making a plan, executing the plan, and really involving all of the staff appropriately in doing that. So congratulations to Eastern Shore Rural Health. And finally, the Children's Doctor. So the Children's Doctor is a pediatric practice, and as such, they are not eligible for MIPS this year. However, their team is organized and they know to be prepared for the future, where they could have to report for MIPS or something similar for medical assistants or other payers. They're now taking the necessary steps to make sure they're prepared for quality measures and improvement activities, even though they haven't had to start reporting their measures yet. So congratulations to our Transformation Vanguard Award winners and the initiation, the self-initiation they've shown in their activities. And our final set of awards goes to 4 people who have really provided great support to Health Vision's Delmarva and our practices. They are not members of the PTN, either because they can't be because they're in an ACO or because they're just another organization, but one of our partners that we work with. So first we have Dr. Joseph Parisi. Dr. Joseph Parisi is with Bay Health Physician Alliance. He has been endlessly supportive of the HVD team. He consistently attends all of our webinars and conferences and has been a speaker on our webinars. He's constantly helping us with content and sharing our message and connecting us with others within the Bay Health community, and we thank him for his support. Dr. Martin Begley, also with Bay Health, has been generous in his support of the HVD team by allowing us graciously to provide seminars using his Clinical Challenges platform at Bay Health. We're really grateful for his support because using Clinical Challenges, which is an established platform, allows us to reach so many more practices. So we thank you, Dr. Begley, for your support. Kathy Wild is from Quality Insights, Quinn QIO. Kathy's been really supportive to Health Vision's team. She's been selfless in sharing her knowledge on MIPS, and she was a key contributor to the content for our Nuts and Bolts of MIPS webinar series. We continue to constantly call on Kathy for insight and expertise, and we thank her for her constant help. And finally, Patrick Weiss, also from Quality Insights, Quinn QIO. Patrick has really quarterbacked our team in ensuring that assessments and reassessments are completed. And that's no small feat because we are a little bit like herding cats sometimes. He always finds the time to accommodate practice schedules for reassessments, and his wealth of knowledge allows the practices to fully understand the TCPI milestones as they go through their assessment process. So, hit the wrong one. All of these practices who we mentioned today, in fact, all of the practices in our PTN will be receiving their awards or their participation validation directly from their practice advisor. And it's going to look a little something like this. This is just a mock-up. But we wanted to let you know that we do have award certificates for all of you. Okay, so I talked really fast there, and we have 3 minutes left, but I do need to just touch on what's in store for year 3. First of all, moving from phases. So most of you go over your assessments with your practice advisors, and many of our practices are in phase 2, which is using data. In other words, you're working on all of the types of things you need to do to be able to collect and utilize your data. But now that we've moved into MIPS, pretty much all of you have some ability to do that. It may not be perfect yet, but you're rolling forward because we needed to by 10-1. So what we really want to focus on in year 3 is phase 3, which is making gains. It's making sure that we are moving the needle on those measures and getting your score into the highest decile that we possibly can. Because eventually we would like to be reaching benchmark, which is phase 4. If you can be at benchmark, if you can be getting 10 points on all those quality measures, you're going to be in really good shapes in the MIPS system. But you're also going to be starting to be really prepared for other alternative payment models that might come your way, whether that be Medicare or Medicaid or a commercial payer. So we're going to be really focused on working through our phases this year. Another thing we're going to be focused on is identification of cost-saving opportunities for our improvement projects. We want practices to continue to work on the things that are important to them, but we want to always be asking the question, what is the cost impact of this? What's the potential to have savings? What is the potential to impact the health of patients in a way that creates cost savings? We have dollar figures that we're going to be sharing with everybody that can show things like, for every patient whose A1C I get below 9, I can save $940 a year in overall healthcare costs for that patient. So identifying cost-saving opportunities isn't only about identifying unnecessary testing and reducing it, or reducing ED visits, or reducing admissions, all of which we would love to do. It can also be improving the clinical picture of your population, and that in turn, because it's high quality, will be cost reducing. So we're going to be focused on that. Identification of ways to incorporate the patient's voice into our improvement projects. So again, we want practices to work on the things important to them. But your practice advisor is going to be asking you always now, how can we incorporate the patient and family's voice into this? Should we be surveying people? Is it the kind of thing that we should ask a couple of patients to come in and kind of do a focus group and ask them what they think about how we should improve? How can we do that, and how can we do it routinely and regularly? And are we taking into account patient activation, the health literacy of our patients, and are we allowing them to be shared decision makers with us? And then finally, learning more about alternative payment models as we succeed in the MIPS program. We have no doubt that our practices are going to be successful in the MIPS program. The next step is going to be other alternative payment models. That doesn't necessarily always mean an ACO. It could be bundled payments for certain specialties. It could be the ESRD model for nephrologists. There are many alternative payment models out there, and it may not even be Medicare. It may be Blue Cross coming to you and asking you to enter into some kind of an arrangement where you have either risk sharing or at least bonus potential. So we want to be able to educate our practices on what those models are, what they mean, and what you need to do to prepare for them. So with that being said, I'm going to ask you to save the date. October 26th at noon is our next webinar. It's going to be on demystifying patient and family engagement, practical advice in engaging in patients in their care. You should be receiving the flyer on that Friday. and we absolutely recommend that you register and that you participate in that event. And so, with that, these are the contact numbers of your practice advisors. If you want more information on one of the presentations that was done today, identify the practice advisor who worked with that practice, and please reach out to them by email or phone, and we can hook you up with those practices if you'd like to discuss further what they did. Thank you, everyone, for attending today, and have a great rest of the week.